Hello again. I'm Richard Knight, President of the American Association of Kidney Patients. Thank you for joining us for the 47th Annual National Patient Meeting. As part of the AAKP initiated Decade of the Kidney, AAKP has purposefully targeted kidney research as a strategic priority for involvement and impact. Our national and global patient advocates and affiliates have been actively reaching out to all involved in the kidney science and research enterprise to offer their expertise and insights. At AAKP, we know that medical innovation and public policy are shaped by research, and without patients as active partners, future innovations in kidney disease and kidney disease care would not reflect our practical insights and lived experiences. Further, since research impacts public policy, including regulatory decisions and issues related to what new drugs and devices are paid for by government and private insurance, it is critical that patients work alongside research experts. Again, this is why you see so many messages from AAKP about opportunities to join a research project at a university through the federal government or PCORI. Our goal is to populate and impact every single kidney research project underway in the United States and across the globe. And as you will hear, we have been helped by research professionals in academia and government who want to work with you and AAKP. For today's session, Patient Consumers, Elevating and Including the Diverse Voices of Patients, I'm pleased to welcome several presenters whose work and personal commitment are for greater care choice and ending disparate health outcomes among communities who suffer the most from kidney disease. I'd like to welcome, once again, another good friend, Dr. Elisa Gordon, who is professor within the Department of Surgery Division of Transplantation at Northwestern University Feinberg School of Medicine. I've had the pleasure of working with Dr. Gordon on a number of research initiatives, and I'm honored that she is able to join us today. Dr. Gordon, I'd like to turn it over to you.
Thank you, Richard. My name is Elisa Gordon, and I'm a professor at Northwestern University. I would like to thank the AAKP for this exciting opportunity to speak with you today. I have no financial relationships to disclose. I'd like to recognize funding from HRSA and IDDK and the Eleanor Wood Prince Grants Initiative. Today, I'm going to talk about two of my research studies on interventions to reduce transplant disparities among Hispanic patients and families. I'll start off by providing some general background information about why reducing disparities matters and about the importance of addressing cultural factors, and then present some of my research. First of all, health disparities are a public health ethics problem and raise concerns about justice or fairness. Considerations of equity as one form of justice is central to our organ allocation policy, and that's written into the OPTN final rule. The National Academies of Sciences was commissioned by Congress a couple years ago to write a report about how to improve fairness, equity, transparency, and cost effectiveness in the donor organ system. And I served on that report, and we found that key components of the transplantation system experience significant variations in performance. And such variation generates inefficiencies and inequities in the transplant system. Though the inefficiencies arise throughout the system in terms of race, ethnicity, socioeconomic status, and many other demographics. Therefore, the committee recommended that we aim to achieve equity in the U.S. organ transplant system in the next 5 years. Now let's focus on one ethnic group, the Hispanic patient population. As you can see from this table, in relation to their representation on the U.S. transplant waiting list, Hispanics have much lower rates of kidney transplantation and living donor kidney transplantation compared to non-Hispanic whites. So you can see here, 21.8% of waitlisted Hispanics received a kidney transplant in 2019, compared to 32.6% of non-Hispanic whites and 5.2% of Hispanics received a living donor kidney transplant in 2019 compared to 13.6% of non-Hispanic whites. Barriers to kidney transplantation and living donor kidney transplantation in ethnic minority groups can be attributed to potential recipient and donor factors such as patient knowledge, attitudes, beliefs, self-care practices, provider factors. This includes healthcare providers' own knowledge, attitudes, and beliefs, healthcare system-related factors like hospital or the health insurance system, and then a whole bunch of social determinants of health also affect people's access to kidney transplantation and living donor kidney transplant rates. So why do Hispanic patients have low living donor kidney transplant rates? Well, there are a number of cultural concerns that are commonly shared among many Hispanic patients, and these include things like religion, concerns about whether religion supports living donation, concerns about the ability to get pregnant or have a child after being a living donor, being able to return to work after donating, and some may have concerns about whether they might become disabled after donating. However, many Hispanics and other patient populations commonly share a lack of knowledge about living donor transplantation, financial concerns, distrust of the medical establishment, among other factors. But there are few culturally competent care interventions that exist to address these kinds of cultural concerns. And culture fundamentally underpins notions of health disparities and ways to reduce them. So what is culture? Here's an old definition that's withstood the test of time here. Culture can be defined as the pattern of knowledge, beliefs, morals, customs that are shared amongst a group of people based on a common identity, whether it's through nationality, heritage, language, gender, or religion. And everyone has a cultural background. Patients and healthcare providers have tacit assumptions about health, illness, treatment that will affect their behaviors, and that's culturally shaped. And what do we mean by cultural competency? Here's a quick definition. This refers to a set of values, principles, behaviors, attitudes, policies, and structures that enable organizations and individuals to work effectively in cross-cultural situations. And similarly, culturally and linguistically appropriate services refers to the fact that healthcare organizations must offer and provide language assistance services, for example, bilingual staff and interpreter services at no cost to the patient or consumer. Now I'd like to share two culturally and linguistically congruent interventions. First, we developed a bilingual, culturally targeted website called Informate. Here's the home page for Informate, living donor kidney transplantation. And what we did was we recruited Hispanic patients and their family members who started the transplant evaluation process at two different transplant centers. And participating individuals were randomized to either receive the website or just to be in the control arm. And those who received the website intervention, they reviewed the Informate website for 30 minutes right before attending the routine transplant education session. And the control arm received just the usual education session. And all of the participants first completed a pre-test, then the website participants also completed a post-test right after they viewed the Informate website. And then all participants completed a 3-week telephone follow-up post-test again. And here are some of our key results. They're a little small here, but you'll notice in the first several columns, these each represent each of the chapters or sections of the website, and the very last column pertains to the overall score. And so there were a total of 282 people who participated. And you'll see that for basically the short answer is the website exposure worked. And so those who were exposed to the website in the intervention arm, they gained 21.7% knowledge increase between the pre-test and the post-test. And at 3 weeks, the website participants' knowledge score remained at 22% above the pre-test, while the control scores increased to just 11%. And if you controlled for all of the demographic variables and other clinical variables, we found that those participants who were exposed to seeing the website, they still maintained a 10% greater knowledge score at the 3-week follow-up period. We also asked several questions about what they thought about the website. And just to give you a quick taste of this, most website participants, 92%, said that they plan to return to Informate in the future. Our findings mean a few things. So first of all, our culturally targeted website increased participants' knowledge about living donor kidney transplantation above and beyond transplant education in Spanish alone. And Informate should be used to supplement transplant center education for Hispanic patients and families. When considered at the broad population level, we think that Informate could have a great impact on knowledge gains in this underserved population that is disproportionately affected by kidney disease. Now I'm going to turn to another intervention. This is the Hispanic Kidney Transplant Program, or HKTP, which was set up as part of routine care in December of 2006 by Dr. Juan Carlos Caicedo, who is a Hispanic transplant surgeon at Northwestern. The HKTP is culturally and linguistically competent at the patient, provider, and system levels. And there's so many examples here, but I'll just call out one for example. So patient education is delivered in Spanish by bilingual and bicultural staff, and the education addresses a lot of the cultural concerns that I'd mentioned earlier. We also have a lot of community engagement and outreach to dialysis patients as well. So in our early work, we retrospectively found that the HKTP was associated with an increase in living donor kidney transplantation in the Hispanic patients who attended that program. But thereafter, we implemented the HKTP in 2 other transplant programs to see if it could also work in terms of increasing living donor kidney transplants in the Hispanic patient population through a prospective evaluation. And we found that the HKTP effectively increased living donor kidney transplantation in Hispanic patients at one of the 2 sites that deployed the intervention with greater fidelity. And the site that did achieve effectiveness, they achieved a significant increase in living donor transplants in the Hispanic patients by 47%. So I'd like to wrap up here with a few take-home messages. We can make a really big impact in reducing transplant disparities for the Hispanic patient population if many transplant programs implemented the HKTP, as well as exposed their patients to the Informate website. And healthcare organizations ultimately have a responsibility to improve equity by embedding interventions like the HKTP or Informate as quality improvement initiatives. And I'd like to thank you so much for listening. I appreciate your attention.
Thank you, Dr. Gordon.